So taking a look at our current situation, and what we know as of yesterday, the 17th of March, is that different countries are responding very differently, and that's leading to a different change in how the virus is spreading. So this just gives you an overview very quickly of the outbreak there in China. You can see in the middle, and it's moving across Europe and then into other countries like Australia, where there's been a small number of cases presented. This, again, is as of yesterday with the current rates, and I think it's really important to note that some of the data is very difficult because, of course, there's a lot of people that may have contracted the virus but haven't presented or tested. So we don't know whether the number of cases is, how accurate that is. And one of the things we can say for sure is that those countries that have good systems in place and good healthcare generally prior to the outbreak have fared a lot better in places like Switzerland, for example, that these countries all have a different number of outbreaks and the fatalities are variable. So again, this information will be available afterwards. There's no need to take notes. However, you can see there it ranges in different countries quite dramatically. This chart also demonstrates where we were as of last week. And again, it just gives you an idea in visual way of how quickly that this rate of the virus is spreading. And so you can see very quickly you reach that critical mass. And as of today, there's now 3 times as many cases from 5 days ago when this was first recorded. So what we also understand is that the coronavirus is being handled differently in different countries. And I want to share with you my personal experience sitting here in Spain. And you can see there that we are on this curve, which is following the trajectory of Italy. Now, you can also see that the reason why I'm going to show you these curves is they're really critical in understanding the population health impact. So if you have a look at how the information is being presented, that what we want to try and influence is the shape of this curve. And you've probably heard in the media the expression flattening the curve. That's what I'm going to be talking about today. So having a look at the incidents in Italy and the absolute collapse of the healthcare system and the diabolical disaster as a flow on, and of course all the stress and distress as a result. And looking at Spain here at around the 9,000, and again this is as of 2 days ago. So here in Spain there's been a total lockdown measures. What that means is that all citizens have been asked to stay in their homes, that schools are closed, restaurant, bars, public pools, libraries, any places where people may convene have all been closed. That the police have been patrolling the streets with a megaphone and asking people to stay indoors, and that people are allowed to out into town to buy food, water and medical supplies, and the police are pulling people over and checking receipts with the timestamp to make sure that they can be verified that that's what their purpose of being outside is for. The other part of the lockdown is requesting that there's only 1 person per car. So this is really extreme measures, and up until very recently, up until just a few days ago, I thought that this was totally draconian of the government to impose this. Having done this research into the statistics, I understand that what they're looking at doing is trying to minimise this rapid exponential growth of the spread of the disease, which we know has an incubation period of a couple of days to 2 weeks. So the challenge that governments face is where to balance the offset of economic downturn versus the rise in healthcare and, of course, this critical mass of overloading our hospitals and our emergency services. So I'm going to show you a couple of video graphics that demonstrate these different models that the governments will be using to determine the policy around how we as a community or we as citizens are instructed to function. And I think it's really important because one of the things we need to think about is our role in the community. And what I'm going to be sharing with you is infographics where I want you to identify the blue as healthy people, those that are brown are sick, and those that are purple are recovered. Because it's not to suggest that this is lethal. It's what we're seeing is that people who contract the illness do recover, but it's the ones that are in constant exposure, and that is our healthcare workers that are most at risk. So I just want to really reiterate that it seems to be the elderly and those with an underlying health, mainly cardiovascular condition, that is putting people at risk. However, the only anomalies that don't fit into that profile are fit and healthy healthcare workers, our doctors, our nurses, and our primary care physicians. So we really need to think about what that means from a population health perspective if our medical workers are the ones that are most at risk. So what I'm going to be showing you here is 4 different government models of population policy. The first one is a free-for-all, and that is what a lot of countries are currently doing, and that is allowing people to just walk around business as usual with shutting down major events. So this is a sick person there in the middle. I want you to have a look at the number of healthy. This is a population sample of 200 people, so it's giving a very small sample. And it just shows you over time how what the spread of illness is in a healthy population when one person is sick and infected. So this is what we're looking at, is this change over time. This red line is the critical mass and the impact on the healthcare system, that all our healthy people are all sick at the same time, and it hasn't allowed the time for those people to recover. This is what we saw in Italy, that they didn't have access to good information to be able to put systems in place to reduce the steep and rapid rate of exposure to the community. So this is the second model, which is called forced quarantine. And again, this is the idea that you can lock sick people in together and that they won't in any way affect the healthy population, and we can see the breakdown in their system. So you can see the barriers there, recognising, of course, that barriers are semi-permeable. It's very difficult to keep a population completely isolated. We can see there the spread as the barriers start to break down over time. And the consequence being, you can see there on the chart above, the consequence of this being, again, a critical time in which sick people and recovered people are still putting this incredible strain on the healthcare system at this point. So the strain comes later, but the idea of quarantining the sick doesn't necessarily lead to, it delays this strain on the healthcare system. So this is the proposed model which a lot of countries are adopting, and I need to explain exactly why this is so significant and why it's effective. And this is the social distancing or self-isolation. Now, this is working on a variable of 1 in 4 people being allowed out, or a free movement of a quarter of the population. So what this allows is time for those to become sick to recover, that you do not get this immense strain on the healthcare system, that it's an elongated strain on the healthcare system. So this is an example of 1 in 4 social distancing. And again, you can just see that the strain on the peak demand on health services is greatly reduced than the free-for-all, allowing people to wander around society freely. So this is the 4th one. This is extreme social distancing, and this is where 1 in 8 people are encouraged or allowed to maintain their usual routines. You can see the lack of movement from the rest of the population if everybody was to stay still, stay at home, and reduce their social contact. So again, the most critical thing here is we're not seeing that many people get sick. Now have a look here. This is the best example of extreme social distancing or extensive social distancing. You can see here that the majority of people do not get sick. Those that are the purple lot have a chance to recover, and that the demand on the health system is not nearly as significant.